there all along, right
Okay.
before my eyes. Go figure. Hello. Welcome. Thinking back to a decade ago when the topic of infertility was still shrouded in mystery and secrecy, nobody talked about it. And if we compare the resources and the opportunities that we have nowadays in 2022 to what was then, it is really it's quite remarkable. I mean, if you look at our conference offerings, we're offering multiple different classes on different aspects of infertility. We had one special for male infertility, if you didn't get a chance to see that one. And then we have one talking about, we do talk about Bruno, the idea that we talk about hard things, we talk about things that are difficult, and we banish, we're working very well in the community to take away stigma to very shrouded topics. There's a special session on PCOS. What we're here to talk about tonight, it's the morning for me, but what we're here to talk about is the impact on the couple. And so I called together my team, and that's Dr. Karen Wasserstein and Dr. Batsheva Maslow, a therapist and a physician, in order, a reproductive endocrinologist, to tackle a topic where we're really specifically talking about how does this impact the couple. We're not even talking tonight about how it impacts the individual as an individual, but rather the individual within the couple and the couple itself. So I encourage you to take a look at our bios. You can see them right beneath our names. And Karen, why don't you take it away?
Okay. Thank you so much. For me, it is evening. So good evening to everyone, or almost good night to everyone. And I'm coming to you from Silver Spring, Maryland. And so I'm happy to be here with Batsheva and with Atara, who I love presenting with, because I do think that the halachic side, the medical side, and the emotional, psychological side really dovetail so much in this area. And so tonight, to speak specifically about the couple going through infertility, and the couple going through infertility is always an interesting piece, because you can never forget about the fact that they're two individuals and a marriage, for the sake of tonight's conversation, going through this together, right? And so there really are three completely separate entities. And the way I usually start talking about this is I talk about the fact that infertility or fertility challenges never always hit a young couple. And by that, I mean, I don't care if you're married, if you get married at 20 or 30 or 40, but nobody is ever married 50 years before they hit fertility challenges. And so that means it's a young relationship. Even if you've dated, even if you've been together, no one is hitting this after 50 years of ups and downs and challenges and hills and valleys and mountains. You're automatically very early on hitting a tremendous mountain together. And that means that couples don't necessarily have those life skills that develop slowly, right? So like, you know, I happen to be teaching a 16-year-old to drive right now. It is very challenging. She's doing great. But as I tell all my kids, right, the only way to be a good driver, no matter how much you learn in a classroom, no matter how many you do those 60 hours, is experience. The more and more you drive, the better a driver you become, because experiences teaches you that. And the same thing with skills. As a couple, you're going to, by definition, have acquired different skills through just living life together and all the different things that come about. So when a couple hit a fertility challenge, they're almost always within, at the very least, those first 10 years of marriage. And so that, I think, is one of the things that really hits very early on. I could keep going, but I want to know if anyone wants to chime in.
Batsheva, do you think maybe you could talk a little bit about the challenges and the conflicts that could arise while in diagnosis and testing and treatment? Like, what comes up? What are you seeing in your office? What do you see in terms of the couple?
Sure. So I'll just take a minute to introduce myself again. I'm Batsheva Maslow. I'm a reproductive endocrinologist. I'm coming to you from New York, so it's nighttime here as well. Yeah, you know, in my office, in my practice, I would echo exactly what Karen is saying. You know, what we're seeing are couples who are early in their relationship generally. Many of them don't have children yet. And this is really the first major crisis that they're facing as a couple. Certainly secondary infertility is pretty common, and sometimes I generally see lots of patients who are struggling with that as well, and that brings its own set of challenges too, because this is something that, well, it worked the first time, and here we are now, we're having trouble. What's changed? You also have to manage the entire process of infertility diagnosis and treatment while also taking care of a child. Adds to a whole nother level of stress and anxiety around that. And there it definitely it gets to the core of what's happening in a couple's relationship. So when I see couples, and I don't always see both parties of the couple, which I know we're going to planning to talk a little bit more about in a few minutes. But what we're seeing here is really like women and couples in their most vulnerable moments. It's an intimate discussion, right? I'm having conversations with them about menstrual cycles and intercourse and timing of intercourse and ejaculation. Like, all of these are very private, intimate things that people don't always want to talk about. They don't feel comfortable talking about it. Certainly if they're worried there's an issue, there's a lot of, there's stigma and shame, and there's a lot that we have to kind of dig through in order for me to get the right information that I need, but also to create that rapport and that partnership so that together we can figure out kind of the best way forward. And it's a challenge, and it's part of kind of developing that doctor-patient relationship is sort of working through some of those challenges.
It's interesting. There's a Haredi rabbi here in Israel who has a community in which the instruction that he gives his community is if you're not starting treatment for 2 years of the beginning of your marriage. Now, on the one hand, we might say, well, that's a little heavy-handed to be like declaring when this couple starts their treatment, and that may have its own emotional impact. But his reasoning is he wants to give the couple the time to develop the relationships tools before going through the difficulties of deeper testing and treatment. So I understand where it's coming from. There's this. Yeah.
I want to just piggyback on something that Batsheva said, which is the idea of trust and vulnerability. So when you're dating and when you're young and married and things are exciting and people are celebrating and you're drawing this picture, because a lot of that stage of life is about drawing pictures together and sketching it out. And you start with pencil and you add in color and you draw this fantastic picture together. And then if something doesn't go according to plan, you have to, trust each other to such a degree to really share what's going on for you, and also share your own feelings of, like you said, shame or guilt or just fragility, vulnerability, that, you don't know what's going to happen next. And you can't even pretend to plan the next step. And neither of you do. So it's hard to lean on each other. And what does that look like? And how do we make decisions together? And how do we talk about things without feeling like we either have to fix it or defend it, which can be very complicated relationship skills. And so, it is real life, and everyone is signing up when they're getting married for real life, but real life can hit like a ton of bricks, and being human is really hard. It's really hard to have all those feelings and to now start, deconstructing the picture, reconstructing the picture, changing it a little bit, and trying to figure that out together. It is very hard. So I hear what you're saying, Atara, about developing those relationship skills and how to do it, which can only really be forged in real life.
It's interesting. There's a midrash in Shir HaShirim Rabbah, which it gives you a little snapshot of what was almost the last day of a couple's marriage. And they were facing fertility challenges. They had been married for 10 years, and they went to Rabbi Shimon Bar Yochai. It's very appropriate as we approach Lag BaOmer to be telling this story. And they went to him and they said, we need to divorce from each other. And even if you look at the language of the text, it says like, we need a divorce from each other, right? It's not a language of one person saying unilaterally that something's happening, which even that kind of indicates, even though we're only getting the snapshot of this last day, it gives this indication of well, this is hard for them. They're not interested. And perhaps Rabbi Shimon Bar Yochai picked up on that nuance and said, hold on, there's a relationship here. So he gave them I guess he was the couples therapist, and he gave them experiment. What's the word I'm looking for? My vocabulary is still coming on
A
board this
homework
morning.
assignment.
Yeah, a homework assignment. Thank you, to go and go home. And just as they partied to get into their marriage, they're going to party to exit their marriage. And so they go home and they get inebriated and they're having a really special time together. And he gets kind of sleepy. And as he's on his way to sleep, he says, my dear, any precious object you see, I want you to take it and go to your father's home. So what does she do? He falls asleep and she calls to the servants and she says, pick him up, carry him to my father's house. And he wakes up in the morning and he's like, where am I? What just happened? And she said, well, you told me to take whatever's precious to me and take it home. And I have no more precious belonging than you. And it's interesting because the word chayfetz sounds so like object, but it's belonging. And this couple had created a sense of belonging and togetherness through a really, really tough time. So even though we only see that snapshot of that day, so they go back to Rabbi Shimon Bar Yochai and they tell him, they're like, we just can't do this. And just a little caveat, from a halachic perspective, there are statements in the Talmud which indicate that if a couple is married for 10 years and they do not conceive, then, or have a child, I should say, then they have to divorce, which is incredibly painful. So to have this little snapshot of this was not what they wanted. They actually did, through thick and thin, build something gorgeous and build something so precious that they didn't want to let it go. And so Rabbi Shimon Bar Yochai knew how to pray for them then, right? It says he prayed for them. And I think that sense of like, now he understood them, right? He made them do the work to see this isn't something we're going to give up on. And just to add to that, that rule is basically not applied nowadays whatsoever, that 10-year rule. And thank God we have, imagine if Bathsheba was around for this couple, in antiquity to help them through their fertility challenge. We have so much more knowledge, even though we have still so many things that we don't know what's going on in so many cases of unexplained infertility. But it is and solutions, even if you don't know. But I think that this story is amazing. And then, of course, the last line kind of gets to you because it says, "V'nifkedu," they were redeemed, they were, healed, meaning just like the imahot, it uses that term of pakad, and to be visited and basically they had a baby. And that part, there's part of me that's like, but what if the ending was they didn't? Like, what if the ending was, and still they had built something so stunning and beautiful and, belonging together?
What I like about that midrash is it a little bit, well, what I like and what I have trouble with it is it a little bit sugarcoats it, right? Like you said, it gets wrapped in a beautiful, nice bow, exactly the way you would want the fairy tale to end. And they really do pick each other and all of that, but it doesn't eliminate the chapter of hurt and the chapter of distrust and the chapter of difficulty, that they had gotten to the point where they really said, we need a solution. Where he said, take anything. And, there's nothing more I can do. The hopelessness and the almost the yeush of just giving it up. And there's nothing I can do anymore, this futility. And I think a lot of couples are afraid, reasonably so, of all the things that are very hard to say. Like, well, what if I don't pick them? What if I don't feel now or ever that this would be enough? Or what if I do feel blame? Or what if I feel that he or she will blame me? And all the things that are extremely difficult to even work out how you feel yourself, because you're supposed to have this, shiny wrapped life. And what if you need help with it, which is often where the therapist or the couples counselor can come in handy, because if only we had a crystal ball, right? If we only knew exactly how the story would play out, we might know exactly how to feel along the way, but we don't. And so it's hard. It's really hard. And how to get through those different experiences and figure out how to navigate that together, separately and together, is a big piece of the puzzle you can't skip over.
Yeah, and I would add just like the concept, and partially it's what we're doing tonight, is like normalizing the fact that it's really hard. And like it's normal to have some of these really confusing, complex emotions individually and as a couple. And I see it in my office. I see the people, the couples who are, you know, they're putting on a happy face and they're like, they're note taking and they're like, okay, we've got this, we're on it. And some of them that's genuine, and some of them, they are like they have their lives together. Um, and maybe I don't see them in their moments of breakdown. And other times, like I get a front row seat to a complete, loss of, so showing a side that this couple would never show out, exteriorly, fighting against one another, blaming one another. And all of those things are actually totally normal. And those are feelings that are, amongst a smorgasbord of appropriate things that can come up. Um, and I think the idea that it's okay, that I, as a physician, I'm going to have just as much respect for the couple that loses their control in my office, as long as they're not being rude and disrespectful, um, as I do to the couple that's kind of holding themselves together. Because I know the reality is that we can't all be held together at all times during something like this.
And I
Yeah.
think it's important to know who's the best support for you at what point. So, yes, of course, you need to be each other's support, but it's also important to have other supports in your life. And it could be, that you need more than each other, right? And I always talk to clients about like if your privacy setting is set too high, it means you get no support. So you don't need to lower your privacy all the way, right? If that's not comfortable for you, but you do have to lower your privacy wall enough to get the support you need. And the support you need may come in different forms. It may be that you get together with your friends and don't talk about it. It may be that you confide in a family member or in a friend. And sometimes people find they can confide in someone else who has told them they've had a miscarriage or have had trouble, but who aren't their closest, nearest, and dearest, because that's who understands them best, or a support group or something online. But and often what you see with a couple is they have very different sense of where that privacy wall should be and how much they want to talk to other people. I often talk to people about maybe taking one step closer to each other. You don't have to be the other person, and you don't have to be, exact. I always tell people that I read this brilliant thing many years ago. It said, different means not the same. It doesn't mean better than or worse than. So yes, if you have maladaptive coping skills, that's one thing, but people can cope differently and people can have a different sense of how private they want to keep things. But if two people are very far apart and they each take one step closer to each other's comfort level, they let one person in, or, if instead of everybody in for this person, or they understand they really can't talk to everyone because the other partner would be uncomfortable with that, that one step speaks volumes and brings them so much closer than you would expect.
Well, one of my favorite Ma'amarei Chazal is for the beginning of Masachet Brachot, where it says, Ein chavush matir atzmo mibeit ha'asurim, that someone who is locked up, whether physically or emotionally or spiritually, sometimes needs someone else to come and let them out. And so bringing a couple to the point where they both understand what the other one needs in order to be emancipated is something that's quite important. In contrast to the medrash that I started out with, our tradition sees the other sides of things, right? We see Avram has, we his reaction is not one that we might want to repeat, because his reaction is to daven for himself, whereas and that was, Sarah did not like that very much. But then you go a generation and you see that not all patterns must be repeated, because when Yitzchak and Rivka were facing infertility, they davened together, facing each other. And the midrash is a beautiful midrash that says that Yitzchak was spread out on one side and she was spread out on the other, and they both said to each other, Ribono shel olam, all of the children that I have that you give me, sorry, I take that back. He says, all the children that you give me, may they be from this righteous woman. And then she says to him, may they be from this righteous woman. And actually, I love the way Midrash does that, because it could have said, they both said to each other, but the Midrash takes the time to lay them out as individuals. Everything that he said, right? He said all of the children should be through this woman, and she said the same back to him. So there was a repair, a generational repair. Whereas when you move on in history and to the story of Shimshon, whose parents also were waiting to be given a child. So there's a midrash that shows a bit of the other side, and very explicitly said Manoach and his wife were fighting. He was saying, it's your fault, I'm blaming you. And she was saying, no, I'm blaming you. And they did not have the diagnosis. It's interesting because sometimes you could tell in ancient times who's with whom the challenge is, or if it's with one or the other, because if they marry someone else, or if they have multiple wives, then we might have more of a sense of who is facing the fertility challenge. But in this case, they did not know. And therefore, so an angel comes along, right? That's straight in the text. And that teaches us that, Manoach's wife, she was righteous. The angel spoke with her. And it was basically the angel came and said, it's your issue. And that, of course, again, I kind of wish we had one which said it's his issue rather than it's the female's issue, because that plays into another stigma that is so crushing and difficult for couples when they just always think like the default is it's her fault. But I think, again, our to have all of these different texts, and this is just a tiny little snapshot, which together build a picture of there are very different reactions. A couple might build stronger through it, even if they're facing it not after 50 years of marriage, and a couple might really face challenges and have differences of opinion in terms of who they confide in, and figuring out how to respect each other's needs while getting their own individual needs is a challenge in a lot of aspects of marriage. But it certainly comes up here.
Yeah, I mean, I think I would echo what you said, especially since, look, infertility treatments are more successful now than they've ever been. We're able to help an unprecedented amount of couples, and yet it's never going to go exactly as planned. Meaning, just walking into the fertility doctor's office was on nobody's list itinerary of what they were going to do. So that in and of itself already gets you to a plan B. And then even with the fertility treatments, there's always going to be bumps in the road. Some are bigger than others. And, as the physician, I often am in the position of trying to share and also guide couples through some of those challenges when things don't go the way you kind of hope and expect they will. But that's kind of built into the process, and it's almost like an added challenge. Like, couples can be like, okay, we can deal with this, but there's so much unknown, and then you cackle on like this new thing that happened that we didn't even know could possibly happen. And so it becomes a real journey that adds some definite stress to the relationship.
I think that I always say it to my clients that I call it the problem of 2022. I adapt it every year. You should know, I've been saying it for years and years, but it's the problem of modern times. So we'll call it right now the problem of 2022, which is that we think we should have all the answers. And once we can identify something, we can fix something, but it's not true. Right. And so not everything is fixable, and not anything has 100% chance of success. I've never heard a doctor give something 100% chance of success ever. And I doubt I ever will. I don't care what year number we get to. I'm pretty sure that's never going to happen. And so, but we actually live in a time with so many solutions that when there isn't one, or things don't go according to solution plan, that can be extremely devastating for someone. And so what you'll also often see in a couple is one person, and I don't want to gender stereotype, so I just keep saying one person, but one person is often very solution focused and very action focused. And I've seen couples where, one person is having a lot of trouble emotionally, psychologically coping with the things that are happening. The other one's like, yeah, but we can do this, this, and this. So whatever, like we'll have a kid, right? And so when one person is very action oriented and the other person is much more process oriented, it's very hard to share that space, right? And so it's about, again, it's about both of them taking a step towards each other and taking the time to understand that this person is action oriented. Okay, so what are the items on our list? And just remember, right, hopefully they're having good doctors like Batsheva who are saying it's not 100%, right? Like whatever percentage I can give you, we're going to go with whatever happens. And then to take the time for the other person to be process oriented. And it doesn't mean you have to be the other person, but you do have to understand that there are different ways of experiencing this. And it's usually not even like one person is 100% action and the other one's 100% process. But sometimes when one person takes one role, the other person takes the other role because it's not happening. And so you leave a vacuum where the other person fills it, when really, when you can try to work on a little more balance, right? 80-20, 70-30, one person doesn't have to carry the action load and the other person carry the process load. And so when you start being more collaborative in both sides of that, it can really free the other person, right? I think emancipation is just going to have to be a theme here, but it's going to free the other person to be more of them, more to experience both sides of that equation as well. So no matter what gender that's working with, you want to just understand those two different ways of engaging in the whole journey, right? I know some people hate the fertility journey, but it's just a good one. So I don't have a better one in terms of how, sometimes making sure that one person isn't left to hold one side of it alone.
I love that. How many times have we done the three of us presented together? I feel like that's the first time I've heard you describe it in that way. And it's definitely something now that you've put words to it that I see in my office, and sometimes within the same person, right? Like there are times when they're more action oriented and times when they're more process oriented, or you have that dynamic between the couple. But now that I'm so glad that you kind of described it in that way, because I can kind of see that framework. And I think that's very true.
So, Karen, can I ask you something? Not all coping mechanisms have been created equal. What are some of the coping mechanisms that one or the other or both within the couple might be reaching for? And are there some that are more helpful for helping them through the emotional experience, toward the other side of the emotional experience or within the emotional experience? I didn't say journey, I said experience.
I like experience. That's good.
We'll use that now. But yeah.
Yeah, I'll try. It's hard because, right, it's very individually based. So I don't want to give things that are too general, but of course I'm gonna try. So I think first of all, denial, not so helpful, right? I think we don't need a panel to tell us that. But sometimes people are in medical denial, right? So some of what I was saying, like someone who's like, whatever, there are things we can do, it's no big deal, is a little bit in medical denial that's like a slam dunk, 100%. I don't even know why you're having trouble with this. It's both emotional and medical denial that, if we do A, B, and C, then we'll have a house full of kids. I don't know, right? But they can't kind of stay in the moment of uncertainty. And so there's a denial that life may or may not go exactly according to sketch. So that I think it can be harmful. Isolation, not my favorite. That does not mean, I just sort of really be clear, that does not mean knowing your limits. That does not mean having boundaries. Isolation is different. Isolation is maladaptive. Boundaries, limits, beautiful, perfect. Everyone should know what those are, right? And then you push it as far as you can, and then you leave. So look, a lot of my clients talk about going to baby showers, which is not something so much in our world, but talk about a bris or talk about, there are plenty of life cycle events that are very, very difficult for people to go to. And it may be hard for people to go. And so knowing your limit and knowing when you go and when you leave, and how much you hang out with your friends, at a 1-year-old birthday party and all those things, and knowing, and I always tell couples, for example, they go to, their best friend's kids' 1-year-old birthday party and they don't want to isolate. They don't want to not go, but at the same time, they know that they're going to hit their limit with everyone talking about strollers and breastfeeding and this and that. They're just not going to, they're going to hit something. So to talk to each other beforehand and say, listen, first of all, you can tell your host, I'm going to come and I'm very excited to be there. We may have to leave early. That's fine. Explain, don't explain, however you want. Have a plan as to what you're going to do afterwards, right? We really love to go walk along the river. We really love to go to the museum. We're going to go catch a movie. Whatever it is that the two of you want to do, that's fun. That's not baby oriented. That's not, putting yourself in the den of the lion or isolating would be great. But to have something else to look forward to. So I think boundaries and compartmentalization also, which always gets a bad rap. If you look it up, everyone's going to say it's really bad. But what I mean by it also is that you have limits on how much you're talking about this, when you're talking about this. It's not every single conversation. It's not, you have to compartmentalize it and say, we're going to go away for the weekend. We're not going to talk about it. We're going to, we're going to talk about it, and then we're going to do something else. We're going to limit the conversations, not because we're going to pretend it's not there, but we have to also develop our relationship and ourselves in other ways as well. So those are a few that come to mind.
Got it. Batsheva, could you talk to us a little bit about, you mentioned it before, kind of like the dynamic that's created when perhaps the wife is spending a bit more time in the doctor's office than the husband?
Yeah, and this was certainly exacerbated in the last year or two because of COVID, where there's like lots of limitations about how many people can come into the office. And so we were almost imposing this on lots of couples where really only one partner could be present. And now, thankfully, for the most part, that's, a lot of those restrictions are lifted for now. Hopefully they'll stay that way. But yeah, it's, on the one hand, this is an important life event for both members of the couple, right? This is their family that they're trying to start or grow. So it's an important life event. And on the other hand, it's very woman focused in terms of the diagnosis and the treatment. And maybe even the diagnosis to some degree gets split between the two. But she, whether we like it or not, is shouldering a lot of the medical burden of getting pregnant and then, being pregnant after that. And in many ways, it's impractical for him to accompany her for every single visit. Actually, sometimes it gets overwhelming if he's coming for every single visit, like every single blood draw to accommodate two people. But there is an important dynamic there. And what happens as a physician, one of my I play a lot of roles, and there's a lot of hats, and there's a lot of things that I have to sort of consciously and subconsciously do very quickly when I first meet a patient or patients. One of them is build this bridge of sort of trust and the foundations of a relationship. And that really needs to be with both members of the couple, because, they're entrusting me to kind of take the reins on hopefully the future of their family. And it does become challenging when that relationship becomes by proxy. So like I've met with the wife and I haven't met the husband, and yet I'm making these decisions about what's going to happen for this couple and their treatment without him. And he's sort of trusting me because she trusts me. And like, that's nice. I'm glad, but it is hard to do. And when things then don't go the way you are hoping they would go, like we said, these things happen. It's much harder to repair that. Meaning, for the patients who I have a direct relationship with, who have kind of been talking about, okay, this is the steps we're going to take. These are the things that could work. This is what might not work. This is what we'll do if it doesn't. They've been sort of in the trenches on that journey. Again, I know we don't love the term journey. I agree, but this is on the road. Whereas the other partner's sort of just been riding their coattails and is like, okay, so this is what the doctor told me. We're going to do this. We're going to do that. And then when things don't go quite right, this couple, that member, let's say the husband, is sort of left in the lurch. He's like, well, what do you mean? This is not what I was told and not what I signed up for. So it is hard. And then that on my part, often that might be the first time I meet the husband, is when something went wrong and he's coming back and he's like, okay, now I need to know, like, I need to have a real conversation. And that makes it harder for me too, because then I have to sort of work double time to build up that trust and relationship. But it's the reality of just the way things are. And generally I'm very supportive and encouraging of at least initially getting both partners involved, so there's like an understanding of what's happening. And certainly if there's like a very important decision or important turning point, I would want both of them involved, and I will often encourage either for both of them to come in, or if one can't, to get the other one on the phone, so at least they hear what's going on. But some of it is the dynamic of the couple themselves, and sometimes it's not really my place to push that. And just to note that, okay, we're having this conversation. This is what I want you to repeat to your husband. These are the message I want you to get across.
I think you'll agree. I just want to make sure we say it like that. Even when it's a male factor in fertility, the woman is usually the major, like the primary patient. That doesn't mean he's not having surgery or something like that. And I'm certainly not minimizing his medical care, but the part-time job aspect of fertility treatments, and I do think of it as a part-time job. It's like, imagine your regular life and then you add a part-time job. That almost always falls on the woman, no matter what the medical diagnosis is. And I say it like that because it's not blame, it's not fault, it's not any of those things, right? We're talking, right? No one's choosing this, but the very, I've seen a lot of couples where it becomes a very significant issue that the woman is going through all this treatment, and there is often this unspoken layer of, but I'm fertile, right? From a medical perspective, and I'm the patient, and that's not fair. And it's not, right? And it's the other problem of 2022 is we think everything is equal, and they're really, certainly the secular world says there's no differences between men and women. And then I got to tell you, fertility really, there's a big difference between men and women when it comes to fertility, pregnancy, natural, but certainly in terms of treatment. And so that can be an unspoken thing. And then I'm just going to pull in the family aspect. Okay. That most families, if they're paying attention, and they often are, and saying, how long is it taking? And they're often assuming it's a female factor issue because that's what, thousands of years have told us. And then in particular, if it's a male factor issue, I've seen couples who say, I can't tell my family because they already don't like my husband, or they'll never forgive him, or whatever. The family aspects of it can become so much more pronounced, especially a lot of men feel even more uncomfortable talking about it because they have even fewer people who have talked about it with them. Whereas a woman may know someone who's had some issues and maybe told her, heard there was a miscarriage, or heard someone had some issues. It all compounds on top of each other, and where that builds is often between the couple.
We have this idea that within a marriage, you've got the woman, the wife, the husband, and the couple, these three pieces to the marriage. Let's make that a little bit more complicated. When there's a fertility challenge, experience, issue, then you have the wife, the husband, the couple, the doctor, hopefully the therapist, if they're getting proper support, the friends, the community,
the mothers,
the halachic support. What do you say?
Support. The mothers.
The mothers,
the
they're like a whole category in and of themselves, maybe. And the halachic support. And so we're talking about a lot of people intruding on a couple's most intimate, private life. Now, hopefully this couple can be made to feel that they have the autonomy over who is brought into this conversation. But sometimes there need to be, right, with their fidelity to halacha, they want to get the proper halachic guidance. And with their desire for proper medical care, they're going to be bringing, of course, the doctor in, and hopefully being as transparent as possible in order to get the care that they need. But it's very challenging, and also falls into that challenge of polling, where you're just kind of like going to too many people, right? On the one hand, you might have the secrecy, which has its own problems. And on the other hand, having too many people who you're going to for help can be a total different problem. I've seen this in my work as a Yoetzet Halacha fertility counselor, where, perhaps I'll be consulted on a halachic issue, but then he goes and consults a rabbi simultaneously, but they don't tell us that they're consulting two different people. And in many aspects of fertility, the halacha is very clear, and it's not so complicated to adjudicate, but there are significant areas where there's a difference. And one of them is in terms of pacing, in terms of, do we test the woman first and only after we've tried, cleared her from any issues, do we then test the man? And that's coming from a serious halachic concern of shechvat zara levatala, of not wanting to have ejaculation when it's outside of the context of intercourse when it's not necessary, or even to modify that with it when it's not necessary. But that in and of itself can create a dynamic that perhaps a religious couple is facing, that a non-religious couple would not face, which is, in terms of how to the timing. And with fertility, especially later on in if a couple is trying to conceive when fertility is waning, so like every year matters, right? There used to be a halachic, based on that 10-year thing, there used to be the halachic position of what couple needs to wait 10 years before they get any fertility treatments. And that was based on the fact that fertility treatments didn't do that much back when that was the halachic approach.
They did less after 10 years.
And that's exactly what I was going to say. Then you fast forwarded 10 years where her fertility is waning, and you've only hurt the situation. But in any case, thank God that is right. But Chev, I mean, you see a whole range. You see people who are not Jewish whatsoever, but within the Jewish population, you have been exposed to a whole range of hashkafas. Are there any? Do you have patients who have been told to wait 10 years? Has that ever happened to you?
No, I do have patients who, for one reason or another, have waited a long time. Sometimes they blame it on halacha, or they blame it on their circumstances. Often, to me, especially if it's an orthodox, like if it's a frum couple who's 6 or 7 years or more, who's been married for 6 or 7 years and they're just starting to seek treatment now, that usually means there's something else like substantial going on in terms of their sort of ability to manage things. And coping skills, and usually that becomes clear when you first kind of meet them. So I haven't gotten to that extreme where like somebody's been instructed, don't do anything for
Right.
But I have, look, I see a very wide range of brands, for lack of a better term, of orthodoxy, and people who have been given good advice and people who have been given poor advice in the name of halacha, or hashkafa. And it certainly does happen. I've certainly had patients who, maybe it's not 10 years, but have been told not to seek care or to wait, or to, if the first treatment didn't work, then it's never going to, all sorts of things that are really not based in reality, are not based in evidence, and are not broadly shared even within that brand of orthodoxy. So there is a wide range, and I think one of the things we were talking about earlier, in certain terms of kind of encouraging women and couples and men who are seeking counseling, if it's somebody who is not so familiar with kind of infertility treatments and infertility diagnoses, there are many halachic authorities, whether they are yoatzot, whether they are rabbanim, whether they are dayanim in the Hasidic community, who are extraordinarily knowledgeable and familiar, and have like a working vocabulary of the treatments and the options. And many of them are very, very smart and able to give good and sage advice, both halachically and medically, and are able to reach out. I speak to many halachic authorities, again, in various different spheres of the religious world. So there are those that are really have a lot of expertise. And so if the person you're getting advice from maybe doesn't have quite as much expertise, and the advice feels like it's not jiving with what you may have heard from others, or your physician is telling you he or she may have heard from others, it's worth sort of escalating up the chain and trying to find somebody who does have a lot of expertise.
Right. I would say the other thing I would say that is often very gender-based is who's talking to whom, right? And so I see women who talk to their college teacher, et cetera. I see men talking to their Rav, but it's more, I think it's more unusual, certainly not unheard of, for a couple to speak together to a halachic authority, because there's this idea of tzniut, that like, how could you talk about these things? Because, right, even though it's very interesting, because fertility treatment often has nothing to do with intercourse and sex, so therefore it seems like it's right, like it's no different than talking about cancer treatment or heart treatment, or it's a medical thing, but it very often becomes very compartmentalized. And what we're talking about in general with the couple is synthesis, and trying to be able to break down those barriers, being able to talk and just be heard, or be able to experience it together. And part of the problem with fertility is that you're forced to experience it together. It's not like you're like, let's do this together, right? You have no choice. This isn't a road you've decided to take together, except that you're on this road, and so you keep moving forward somehow together. So this synthesis is important in terms of even representing, if one person went to the doctor and representing it back, if one person went to the halachic authority and representing it back, if one person get support and a new understanding for themselves and sharing it. It's a lot of trust that you have to develop and be open to developing and being open to communicate. And so, sometimes when I see couples who are trying to make a choice as to what to do. And I find couples often get stuck because one person presents one side and the other person presents the other side. And then what happens is you just keep kind of digging your own case, like you're on debate team in high school. And so you just keep finding the things that can build the side you're presenting. And so I don't know if I recommended this last year here. I know I've done this before in classes, but what I'll often recommend to a couple is one person takes both sides, right? Like one person presents, here's what this treatment would do and the pros and cons of this. And here's what this treatment would do and the pros and cons of this, because then you get out of this high school debate mode, right? As opposed to like, here's what the halachic authority says. Well, here's what the doctor says. And then you just keep defending whatever it is that you're presenting. We, like almost human nature is whatever we present, we're going to keep like doing a better job at it. And I have another proof and I have another this and I have another that. And let me add to my case. But you're not really trying to win. You're trying to make decisions together. And it's often helpful if one person presents both sides of it. I don't care if it's where should we go on vacation, or should we go to the wedding? There's a COVID, outbreak, and what are our risk assessment? But whatever it is that you're debating, sometimes it's much more helpful for one person to present all of the aspects and then discuss. And so that's another coping strategy that I think can be very helpful, but especially in this area where one person is really presenting and being almost like there's this hearsay aspect to it, making sure that it's all out there to discuss openly and with good communication.
Yeah, I will add the communication piece is very critical. Sometimes I feel like I'm at the end of a chain of telephone. Like I have a conversation with the woman. She then has a conversation with her husband, who then has a conversation with the Rav, who then has a conversation back to him. And then he tells his wife, and then she tells me. And by the time it's done that, it's a little unclear whether all the important pieces have made it through all the way. And that's where, sometimes I'll cut the middleman. I'll say, like, just have your Rav call me. And thankfully, that doesn't need to happen a lot. But sometimes if I really feel like we're not getting the point across, it is nice to be able to do that. And, I have the advantage of sort of having a shared language of being able to kind of discuss this with not every physician.
Right. Imagine if the doctor has no clue. I mean, if they're in the New York area, perhaps they're a little bit more knowledgeable, but we've got people here from all over the world. And I'm sure that they've gone to a doctor or a therapist who doesn't have that cultural competency, and therefore they're not understanding why are they delaying treatment for him. I do want to actually make a little caveat there to make it actually known that Rav Yehuda Herzl Henkins Zatzal, when we were going through our fertility counselors course, we learned so much together as a team of rabbis and yoatzot and physicians and therapists, and he changed some of his piskei halacha to relate to the emotional side of things in a way that sometimes, quite unfortunately, is not done. Which is, he said, both husband and wife are tested at once at the beginning. Okay, let's not set it off that any misconception that it for sure is her, or that, meaning even if that's not the what those who say that you do have to wait are aiming at. They're saying, well, we're going to not violate this law or compromise this law in any kind of way until we have to. And once we know it's not her, or we know it's partially her, but it's not only her, so then we would for sure consider any kind of intervention to not be a violation of law. So it's a legitimate approach, but it is one that I have seen cause a lot of anguish and a lot of lost months, and very painful.
Well,
and similarly,
sorry.
yeah,
I want to throw in just that I don't mean to say, right, that let's say a husband goes to his Rav, that's like the wrong way to go, because going back to the fact that the woman is often the patient, and these couples are often very sincerely trying to even out, well, what can he be doing? He cannot be lying there and undergoing treatment, or his blood work, doing weekly blood work really is not going to do much. So he is trying to do his part, right? No matter whether it's, mixing the shots, or whether it's picking up more things around the house, or doing the childcare if it's secondary infertility, or cooking meal, whatever it is, or going to the Rav and saying, I'll take that piece. I certainly don't mean to disparage it, right? It's just then how do you resynthesize it together and make sure that you're looking, like you said, at both the halachic, the emotional, the medical pieces all together for the couple.
And I would say practically, like I can, I have the advantage of sometimes I can shorten the chain and I can speak directly with the Rav. And again, that doesn't always work, but if you can shorten the chain in these conversations that are going to then be presented to a halachic, advisor, have both be present at those discussions, so that then they can both, if he's going to be the one to discuss it with the Rav, he was there and heard it from the doctor's mouth, or vice versa, have her go with him. And I've actually, even in my most Haredi patients, there are some women who are just, they have a lot of perseverance, and they will go speak, they're not quite as intimidated to go speak either with their husbands or on their own. And as tough as they can be, and that's not for everyone, but they get a lot done. I mean, they're able to really accomplish a lot more in terms of asking more questions, because they can then ask follow-up questions without having to go back and like relay it. And so it becomes much more efficient, and as difficult as it may be for the couples to find time to do those both together, I think in the end you actually get much more out of it, and reduce sort of stress, like long term.
And I wonder how much the pandemic actually has helped, because more people, doctors, therapists, I don't know about halachic advisors, are doing things by telehealth, etc., by video, that you can catch a conversation with two people at the same time who are at different places. It's not always a conversation after minyan, or a conversation where only one person is able to go to the doctor at 3 p.m. or something like that. I know that I certainly have an easier time seeing people because of video, as contraindicated, as counterintuitive as that might seem. But it's opened the door for therapy for so many more people, where the convenience factor is just essential, that I'm hoping that that's true in all of those areas.
I think that's true.
A lot of us grow up on a beautiful story of the Tzaddik of Yerushalayim, of Reb Aryeh Levin, where the wife her leg is hurting her, and he takes her to the doctor, and he says, "Our leg is hurting us." And we grow up on that, and it's so beautiful, and it's expressing this like idea of being one, and having that togetherness in a way that's quite unique. And I think there's aspects of this, and there's aspects of having both of them involved. And I think one of the messages that we're trying to get across here is that's super important. Building that joint piece is important, and having the right people on your team advising you and being on this as much as possible on the same page. And it's also important simultaneously to have your own legs, and to be able to, you can't have the joint leg until you have your own legs. And so I think that's a critical point. We're coming toward the end of our hour, and that's very hard, because we could go on talking for many hours. Maybe we'll just keep talking. But I want to make sure that
you have to start your day.
I do. The children
we have to go to bed.
But I do want to bring us to a place of healing, if we can, understanding that nobody's journeys can be dictated by anybody else's and rushed by an external source. But at the same time, I'm wondering, Karen, if you could kind of give us a nice closing to talk a bit about, we talked about coping mechanisms before that are not so great for handling this kind of situation and grief and all of the different mourning that it might be going on for how they thought things would be. From your clinical perspective, what do you see as coping mechanisms that would be really helpful for a couple or for individuals as they build as strong of a foundation to go through these challenges?
I don't know if I have a good, like, al regalachat answer of a good coping mechanism other than the things that we kind of said that I could just like re-say, but I don't know if that's helpful. What I can say though is how many couples I see who do say that they've really found each other and that their relationship has grown from going through the struggle together. Not that they would have chosen it, not that they would draw the story that way, but that they have found a better understanding of how to cope and how to build that relationship. It almost fast forwards them in marriage in a lot of ways when they're able to find that ability to do it together and understand and respect the differences and the similarities, what they share, what is different, and how to navigate that. I see many more couples saying that than anything else long term. That it's truly given them a much better understanding and respect of their partner, having navigated this and gotten to see more of them faster. So I don't think that answered you at all, but I don't know that I have a better
No,
answer.
I think part of what we're trying to say is you can't get this done in an hour, and getting the proper support, getting to a therapist who can help through some of the very painful feelings that are going on in this kind of time. I mean, I definitely, if you go back to the Rambam in Shmona Prakim, you don't need modern science to tell you. You know what's really good for you? Taking a break. You know what's really good for you? Taking a walk in beautiful nature, seeing a beautiful piece of art, going on a trip together. Maybe sometimes it's hard for couples who are in treatment to think of taking a break, because while they're actively involved, they feel like they're doing something, they're solving the problem. But sometimes what's necessary is to be able to get into the moment, right? It's such a future oriented, right? On the one hand, they're very involved in, what do I need to do today? What blood draw do I have today? And what's on the calendar? And when do I have to wake up? And how am I going to also get to work and all of that? And on the other hand, it's focusing on the future in a way that can be very difficult, like when. And so doing activities that can help you get back into your body and into yourself. I mean, yoga, right? Feeling connected to your body. And we talk about a lot of these things for women. Guess what? Men need these things too, right? They need that coping mechanism of exercise and getting out there and feeling and again, another challenge is that if a couple is in the United States, certainly, and fertility treatments can be quite costly, and then we're saying, go on a trip together. And again, coming from the outside, hearing from someone on the outside, like, you don't know what I am going through. Why are you making suggestions for my life? But at the same time, if we could try to help people through their pain, by not by people on the outside, but professionals helping share the kinds of things that could help with the coping. I think that
Well, I
could
think
be
you're pointing a lot to self-care, right?
yeah.
And self-care, again, just to bring it full circle, it's self-care of all three entities, right? The husband needs self-care, the wife needs self-care, and the relationship needs self-care. And the relationship, when you're going through fertility treatments, does seem very almost object oriented, right? Objective oriented and object oriented. You're here to carry a baby, you're here to give sperm, you're here to, right? Like, it's very object oriented, but it's about finding that subject and then doing self-care for all three entities at the same time.
And I'll add, one of the things I certainly tell myself when I have, stressful times, but I share with my patients a lot, is to kind of try to give yourself the perspective that this is not forever. There are lots of seasons in our lives. There are seasons in relationships, and it's okay if this part stinks. And it's okay if this is a terrible time, and you don't have to have the most loving, wonderful, supportive relationship as long as the foundations are there and the opportunity for repair is there. Like, it can be, you can sort of just live in the badness for a little while, and knowing that it's going to come to an end one way or another. And that uncertainty is hard, but also just acknowledging that this is just a bad season, and we can acknowledge that, and not try to like change it to make it like it may, because ultimately it's not going to be better until it's better.
And I like how you said that, the seasons. I always tell people that like marriage is textured, right? And I think that maybe when you get married, you think it's silky, but it's textured and there are bumps along the way. And there's a lot of beauty in that texture, but it doesn't always feel very comfortable.
Yeah.
Okay, well, this is rounding out our hour together, and thank you for all who joined us. And I just want to make one more plug that Nishmat's fertility counselors are here. I have even a little thing to show you. And we would be here for you to help you through whatever you are facing. So good night, good morning, good afternoon, wherever you are in the world. Thanks for joining us.
Night.